What is Tourette's, and is it something that's fixable, not only with conventional medicine, but with cannabis? And what have you seen in your practice?
Tourette's can be a very upsetting condition because it usually presents in childhood, and it is genetic in some ways. So these kids develop what are called motor tics or vocal tics. It's a condition where patients develop repetitive, involuntary motor tics or vocalizations. And these are somewhat suppressible. So a patient with Tourette's can sometimes concentrate and suppress the tics, but for the most part, they come out. The tics can manifest as shoulder shrugs, facial or head movements, sudden quick movements, repetitive movements, so that for a particular individual, they may have a stereotype movement. I had a patient in the other day who had a head flinging type of movement like this. And I'd be talking to her and she'd be just flinging her head side to side. Many patients will have other types of facial or other motor tics, sudden, brief, repetitive, involuntary motor movements. Vocalizations. Some patients will have an involuntary vocalization like a cursing or a grunting or a snorting. And again, this is involuntary but can be suppressed for a short period of time. It can be very distressing, especially when it occurs in a young person.
So what other important aspects does come along with Tourette's? Are they from mild to severe cases? Can you share some of what you've experienced?
Yes, it's true. There's a spectrum.
Okay.
As with most neurological conditions, there's a spectrum of severity.
Okay.
Some patients have a very mild intermittent tic, maybe just a wink.
Okay.
Joyce and I met someone the other day who we were talking to, and this person had a motor tic on their face. And we were with a whole bunch of other people. And after that individual had left, Joyce and I were chatting about it. We were saying, oh, did you see that fellow had a tic? And the other folks at the table didn't notice it. It was so subtle.
Yeah.
So it varies dramatically from very mild to very severe and disabling. Same thing with the vocalizations. There's everything in between mild to severe. Patients with Tourette's have other conditions that go along with that involuntary repetitive activity. These patients have other conditions, oftentimes mood disorder, anxiety, attention deficit hyperactivity disorder, ADHD, very common in patients with Tourette's. They also develop OCD type behaviors, severe, where they have to check to make sure the door has been locked 5 or 10 or 20 times. They have to clean up things 5 and 6 and 7 times before they're satisfied. So these types of neuropsychiatric conditions, OCD, ADHD, anxiety, often go along with the Tourette's motor and involuntary vocalizations. It can be a complex disorder.
How does one develop Tourette's?
It's often genetic.
Okay.
Yeah, 50% or so of offspring, if I can use that term, of patients with Tourette's develop Tourette's, or some modification of it. Maybe it's just the OCD without the motor tics.
Okay, and so as I mentioned, I don't use the word curable. Is it something that can be fixed?
You know, with conventional therapy, conventional pharmaceuticals, I have never seen tics completely eliminated. But I have read case studies of cannabis treatment that has resulted in complete resolution of tics.
Okay. Because I've seen other, as I mentioned, in epileptic seizures, videos of surgery, and I've seen this with Tourette syndrome as well. Is that another common procedure?
Not so much for Tourette's.
So when you have a patient that comes in here, what is your protocol?
First, I make an assessment as to how much treatment the patient wants, because Tourette's patients are interesting from a personality standpoint. Many of them are very high functioning and are perfectly capable of carrying on with their lives if left alone. The tics may be bothersome, they may be embarrassing, but that person is completely okay oftentimes with their condition and they just want to carry on. But they want to treat the motor tics because it bothers them in social situations. Interestingly, Those patients that take medication to suppress the tics
Yeah.
enjoy stopping the medication because it's an unnatural feeling for them to suppress those movements.
Okay.
And I've heard people tell me time and again that when they take their medication during the day to suppress the tics, they can't wait to get home and just tick out. They just like, and that makes them feel better. Fascinating. It's a natural state for them. And if they can function normally with those motor and vocal tics, that's the way they would rather be as a group in general.
Okay. So are there case studies that show conventional medicine is working?
Yes, we have conventional therapy that is effective.
And so what do you say for the patient that's following us right now, that's looking at cannabis as an option, or they're already using cannabis?
Well, if they're already using cannabis, chances are they're seeing some results. We have a lot of patients that self-medicate with cannabis, especially younger people that are more open-minded to this kind of thing.
Via smoking inhalation, via vaporization of smoking, or sublingual sprays, tinctures?
I think probably the individuals that are self-medicating are inhaling the medicine primarily.
I've seen, that's what I've seen the majority of cases having success with, either smoking vaporization or smoking via a joint or a pipe.
It works.
Yeah.
It works. I know someone personally who grew up with Tourette's and has been self-medicating for years, and it works quite well.
Are you seeing any certain formulations or dosing practices, protocols?
Well, in the studies, there have been a few observational studies. The higher THC, actually, the type 1 therapy for adults has been the most effective. 10 milligrams THC, small amount of CBD, quite effective for adults. In the kids, we want to avoid too much THC, just in case there's psychoactive side effects or problems with development over a long term. So for the kids, we use a higher CBD or a type 2 equal ratio. But for the adults, it's higher THC.
Higher THC. And do they have these tics at night while sleeping?
No.
So it's really, why is this?
The brain is asleep. It's the same thing with the Parkinson's disease patients. Their tremor completely stops when they're sleeping. Sometimes when I make rounds at the hospital, I'll go in to see a patient with Parkinson's. They're sleeping sound. They're perfect quiet. I go in there, I shake their shoulder, they wake up, and as soon as they wake up, they start shaking. So that's just the way it is, John.
So are you finding, again, with the pillars of health, how important sleep is, for all bodies?
It's restorative. Those patients are resting when they're sleeping. Those abnormal, or I should say, not so much abnormal, but hyperactive motor activities, they're at rest.